Let's go to visual diagnosis inspection. The topic is tongue body color. Here we can see the observation and the significance of the tongue body color. If it is pink, that is a significance that the tongue is normal. Pale and white is signifies yang deficiency, cold, or excess cold patterns, and qi deficiency. Pale and dry is blood deficiency, and in some cases, yang deficiency. Pale sides is an indication of liver blood deficiency. Pale orange sides is liver blood deficiency as well. Red is excess or deficient heat, depending on the coating. The entire tongue can be red or only the area that relates to a specific area of the body or a specific organ. For red tip, there is heat in the heart. Red sides is liver heat. The red central area usually indicates stomach heat. Red spots is heat, and or blood stagnation, depending on size and the location of the spots, given an indication of where the heat is in the body. If it's red and wet, that's short-term heat or damp heat. In rare but very serious situations, this is a sign of true cold or false heat. When it is red and swollen, there's pathogenic heat in the interior or heart fire. Purple or purple spots is blood stagnation, and the whole tongue or just specific areas that relate to the organs involved can be purple. And the purple color will be either bluish purple, which is cold stagnating blood, or reddish purple, which is heat stagnating blood or the stagnant blood generating heat. The purple veins on the underside of the tongue indicates blood stagnation, and pale veins on the underside of the tongue is blood deficiency or qi deficiency. Milky veins on the underside of the tongue is damp phlegm. Extended veins on the underside of the tongue is heat. Purple spots on the underside of the tongue is blood stagnation. Pale white. Pale white here is paler than the normal light red, more white than red, sometimes without red. It results from deficiency of both qi and blood or depletion of yang qi with loss of the motive force for blood flow. In both cases, blood is unable to flow upward and nourish the tongue. Thus, a pale tongue indicates an illness of deficiency or cold. A pale and small tongue suggests deficiency of both qi and blood. A pale, fat, and tender tongue suggests gradual decline of qi. A bright red color of the tongue develops when heat excites qi and blood so that they flow more vigorously. As blood fills the vessels to capacity, it also collects in the tongue and gives the tongue the red color. A red tongue indicates heat. If the tongue is red and rough or hairy and has a thick yellow coating, it suggests exogenous heat. If it is red, plump, and tender and has scant coating or fissured or smooth without coating, it suggests endogenous or deficiency heat. Red in the tongue tip indicates strong fire in the heart, red in the sides of the tongue, blazing fire in the liver, and red in the middle of the tongue, strong heat in the middle jiao. Crimson is a deeper red than red. The causes of crimson color in the tongue are the same as those for red color, except that heat or fire is stronger. Thus, crimson indicates extreme heat. In illnesses caused by exogenous disease evil, a crimson tongue indicates that heat has entered the nutritive and blood levels, or heat is hiding in the heart and the stomach and transmitting in retrograde fashion in the pericardium. In internal illnesses, it indicates blazing fire in yin deficiency or depletion of stomach and kidney fluids. The tongue coating is correspondingly dry or fissured. A crimson moist tongue with little coating suggests blood stasis causing internal blockage. Both red and crimson color indicate heat. The deeper the red, the stronger the heat evil. A change from light red to deep red to crimson indicates that the heat is evil is strengthening and the illness is worsening. Conversely, a change from crimson to deep red to light red indicates that the heat evil is retreating. A purple tongue suggests stagnation of qi and stasis of blood, or impeded blood circulation. The latter is due to exogenous cold or heat, deficiency of yang qi, alcohol poisoning, food retention, phlegm and rheum, or dampness heat. If heat is strong and damages fluids, thus indicating qi stagnation and blood stasis, then the tongue turns crimson or purple, dry and dehydrated. If cold becomes gelled internally and induces blood stasis, then the tongue turns light purple or blue purple, but remains well hydrated. A blue tongue is seen in strong yin cold in the interior bottling up as yang. As a result, the motive force for blood circulation is weakened, leading to blood stasis. If the entire tongue is blue, then yang is trapped in the interior by gel cold. Yang deficiency permits gelling of cold, or there's blood stasis in the interior. If only the sides of the tongue are blue, then there is blood stasis. Thank you so much for your attention.